expected, we have the frontalis, which is the same as the frontal belly of the epicranius. So the frontalis, right up here in the front. On the back, we have the occipitalis, right? The occipital area, you would expect it. Occipitalis, right there on the back. So frontalis and occipitalis is again the same as the occipital belly of the epicranius. Same thing. And then we have the temporalis, which is actually not this here. We're not going to even deal with that muscle. And it's not this here. The temporalis is this big giant sheath here. You have to peel off this guy in order to see it. And that's the temporalis there, stretching across the entire temporal bone there. So nice big temporalis. Okay. Then we have wrapped around the eye, the Orbicularis oculi. Orbicularis oculi. Wrapping around the eye. Orbicularis oculi. Wrapping around the mouth, we have the Orbicularis oris. Orbicularis oris around the mouth. And you can see all these on him too. They're just a little bit hard to find in this model here. Orbicularis oris around the mouth. Then starting at the chin, we have the mentalis. It's going to be this little muscle right down here, right in the mental region, right at the base of the chin there. The mentalis. Mentalis. Moving a little bit laterally, we get to the depressor labii inferioris. Depressor labii inferioris. Just lateral to the mentalis, depressor labii inferioris, right here. And then we have this big giant muscle that sweeps downward. This is the depressor anguli oris. Comes from the corner of the mouth and sweeps down. Depressor anguli oris. Depressor anguli oris, this big giant guy here. Depressor anguli oris. So we have the mentalis, depressor labii inferioris, depressor anguli oris. 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 Okay, coming straight back from the corner of the mouth, we have the rhizorius. This guy right here is the rhizorius. It's coming straight back from the corner of the mouth. It's the rhizorius. Rhizorius right there, straight back. And then we have this guy that goes up from the corner of the mouth to the zygomatic arch here. This is Zygomaticus Major. Zygomaticus Major comes from the corner of the mouth, goes up to the zygomatic arch. So that's the Zygomatic Major coming up this way. We also have Zygomaticus Minor, which is this little guy here. He's following the same pattern, but kind of just anterior to him. Zygomaticus Minor is this little guy right here. Zygomaticus Minor right there. Following the same pattern as the major, but kind of a little bit anterior and a little bit superior to him. And indeed, that's kind of a trick you can use, is that on any muscles where we have a major and a minor, the minor will usually be above the major. Then we have this muscle here that goes from the corner of the mouth and kind of goes up the side of the nose. This is the, I always get the words messed up here. The levator labii superioris. I always want to say depressor, it doesn't make sense. Levator labii superioris is this one that comes from the corner of the mouth, runs right up the side of the nose. Levator labii superioris, that levitates the corner of the mouth. Levator labii superioris. Right there, comes from the corner of the mouth, runs right up the side of the nose. Levator labii superioris. Okay. Now we have two muscles here in the side of the jaw. We have the big old masseter muscle involved in TMJ there. So we have the masseter muscle on the side of the jaw. Main muscle involved in TMJ. Big old masseter on the side of the jaw here. Big old masseter. And then, beneath the rhizorius, deep to the rhizorius, there's two little triangles of muscle. They're part of the same thing. This is the buccinator. So deep to the rhizorius, right down here, right beneath the rhizorius is the buccinator. The buccinator is the cheek muscle. That's what allows you to do the fish face. So buccinator is the cheek muscle right there under the rhizorius, just deep to the rhizorius is the buccinator. Okay, I think that's all the ones for the head. So continuing on down the neck, we have this big guy here that we're also going to see on this guy. This is the sternocleidomastoid. Sternocleidomastoid. Oh, I did forget a couple. Well, I'll point them out in a second. Sternocleidomastoid is this big one here. Sternocleidomastoid, which we also see on this guy. It's these two. These two right here are the sternocleidomastoids. You can see they go from the mastoid process out to the sternum and the clavicle. Hence, sternum, cleido, clavicle, mastoid, mastoid. Sternocleidomastoid. And this is indeed the muscle that's going to have its origin here on the sternum and clavicle, insert into the mastoid process, and tug on that mastoid process, allow you to do the diagonal down motion, and that will end up creating that mastoid process from your blank fetal skull there. So sternocleidomastoid. And you also have a muscle right here. If you tense your neck, this muscle right here, when you tense your neck, is the platysma. So that's the platysma. It's a dermal muscle, which means it attaches to the skin here. So when they go to make a cadaver or any of these models, that's usually removed. So that's the platysma right there, and it tenses the neck. Let's see. Yeah, so this platysma. Oh, and we have the corrugator supercilii. That's going to be this little eyebrow here. So corrugator supercilii. This eyebrow here is the corrugator's supercilii. So eyebrow muscle, corrugator supercilii. Okay. Okay. Continuing on down the neck. Now, on the back here, there's a big old diamond-shaped muscle, the trapezius, that covers the entire back. So we have the trapezius. Now they've removed it on this side, leaving only half of it here. So this is the trapezius here. It should have two halves that would make it a big giant diamond shape. So that's the trapezius. So this big giant muscle here. When you peel that off, you can then see musculature beneath that. And we have the splenius capitis here, running right along the back of the neck, is the splenius capitis. Splenius capitis, guy running right along the back of the neck. Continuing down the back, running along the spine, we have a group of three muscles here. This is the erector spinae group. So these three muscles here, the erector spinae group. And the erector spinae group can, of course, be broken down into the spinalis along the spine, spinalis right along the spine, longissimus in the middle, longissimus in the middle, and then the iliocostalis is the lateral most. It's going from the ilium along the costal ribs there, hence iliocostalis. So spinalis along the spine, longissimus in the middle, iliocostalis along the ribs. Spinalis, longissimus, iliocostalis. Together they make up the erector spinae group. And they're called the erector spinae group because when they contract, they erect the spine. They cause the spine to extend. And so in order to stab someone in the back, you've got to be pretty sly. Spinalis, longissimus, iliocostalis. Okay. While we're still on the back here, I'll also point out latissimus dorsi, big old sheet muscle here that runs along the back and it actually ends up inserting on the humerus here. Latissimus dorsi, so it's going to move the humerus, but it's also used to move the back as well. Latissimus dorsi, that guy there. Okay. Let's see here. Okay. Moving into the chest area. First off, we have muscles between the ribs. These are going to be the intercostals. Intercostal meaning between ribs. And we have two groups. We have the internal intercostals, which are here closest to the sternum. So we have the internal intercostals closest to the sternum. You can see them down here too. And then we have external intercostals towards the outside. External intercostals toward the outside. So the intercostals are pretty easy to tell apart because internals are near the sternum, externals are away from the sternum and more lateral. However, they also exhibit a characteristic we can use for other muscle groups. And you can see them on this model if you look closely. Anytime you have an internal muscle, its fibers make an A shape. If you were to join the two sides of the body together, the fibers make an A shape on internal muscles. They make a V shape on external muscles. So the fibers on external muscles make a V shape when you join the two halves together. So the internal intercostals have an A shape to their fibers. The external intercostals have a V shape. Okay. Moving down to the abdomen, we have here the rectus abdominis. The rectus abdominis are the six-pack muscle here. It's the rectus abdominis. Six-pack muscle. And then the walls of the abdomen are actually going to be made of three muscle layers. So you have three layers of muscle making up the walls of the abdomen. The outermost layer, the superficial most layer, is going to be the external obliques, which we see only on this side of the torso here. They're removed over here. But you can see on this side, the fibers would be making a V shape, right? To follow the fibers. If we had it on this side too, it's over here. External obliques, you can see they make a V shape. They peeled off the external obliques to show us the internal obliques over here. And the internal obliques, you can follow their fibers and likewise make an A shape. So we peeled off the external obliques to show the internal obliques. That's the middle layer. And then our innermost layer, we take off the chest piece, is the transverse abdominis. So the innermost layer is the transverse abdominis. They run horizontally across the abdomen. So the deepest layer is the transverse abdominis. On top of them, superficial to them, will be the internal obliques, and then the superficial most layer are the external obliques. And so he doesn't really have three muscle layers so much on here, but like the little people, if you look at them, you take off their chest piece, you can actually see their three muscle layers on there. And I think the red torso, his chest piece, has all three layers on there as well. Okay, what did I miss? Finally, going into the abdominal pelvic cavity with the retroperitoneal space, we have two muscles. We have the iliacus right here in the iliac fossa. Iliacus right here in the iliac fossa. And next to that, we have this big giant beefy muscle, the psoas major. So psoas major right here next to the iliacus. So iliacus, psoas major. Psoas major is a big giant beefy muscle running right down the back. They're both going to end up connecting down to the femur and flexing the femur, but they can also contract to flex the spine as well.
What is it, iliacus again?
The iliacus is in the iliac fossa.
Okay.
The psoas major is the big giant beefy thing that's running next to it. And psoas major really is big. We'll see on the cadavers especially. It's just a big piece of muscle sitting in the back there. Okay, I think that's it. Did I miss anything? No? Okay. I think that's it for now then.